Welcome to the UK PTs podcast, where we delve into the world of personal training one episode at a time. Here are your hosts, Joshua Mullen and Mark Laws.
Okay, Mike, so we are going to induct you into the 27 Club, which is 3 rounds of 9 questions. The first round is based very loosely on your education, your educational background. So you have 90 seconds to answer the 9 questions. Josh, you are the timekeeper.
Got it.
There we go. He's ready. He was born ready. Okay, so Mike, in what year did you qualify?
2012.
Okay, and who was the education provider?
It was the split between two, so University of Kiel, University of Stafford.
And how long did it take you to qualify in your chosen profession?
5 years for that particular one.
What was the last bit of CPD that you completed?
Oh, I did a motivational interview and behavior change seminar with Gary Mendoza.
Very topical. Good man, Gary. And what is the next bit of CPD that you have your eye on?
The full course with Gary Mendoza.
Good plug there, Gary.
Yeah.
What is the highest level of qualification or education that you possess?
I've got a postgrad certificate.
Okay. And should a personal trainer ever be reassessed? And if so, how often?
Yeah, I think it's a good idea to do that. I think probably annually, maybe every 2 years. I think it needs to be fairly recent because things change. Some things don't, but some things do. So some bits would need updating.
Cool. And are you qualified as a PT, by the way?
Yeah. So I qualified as a PT back in 90. Well, there wasn't even a PT qualification then. So 94, 95.
Jesus. Okay. So what skill did you gain from that PT course that you use most often today?
Coaching, big time.
Nice.
And being able to get across progression and regression of exercises as well. I think it set me up really good for that.
Cool. And last question, on a scale of 1 to 10, how good are you at your job?
I would say an 8, a good 8.
Solid 8, pushing for an 8.5.
Yeah, as my dad said. Yeah, where's the other 2? Come on.
Yeah. Well, my dad says, Mark, where's the other 8?
Yeah.
Right, round 2. Josh, over to you, and I'm in charge of the time.
Okay, so Mike, round 2 is all about your industry experience. So, number 1, name the most underrated person, product, or thing, in your opinion, in the fitness industry.
Underrated thing. Oh God. Probably the stuff that Gary does. Actually, Gary, I've mentioned him 3 times already. Communication is the most underrated thing. I think we always think it's things that we do to people, but it's the things that we do with, I think.
Nice. Okay. And what's the most overrated person, product, or thing?
It changes all the time, but the latest, it's like HIIT training now is basically circuit training 20 years ago. So it's just the recycling of the same thing.
Agreed. So next one, which book should all personal trainers read, in your opinion?
Greg Lehman.
Nice. Okay. Foam rolling, yes or no?
Sometimes.
God damn it! For how long did you work in a gym before becoming exclusive as a PT?
I worked for 10 years in a gym.
Nice.
Wow.
Yeah. Which common fitness myth? This can also be, therapy. Do you wish you could debunk forever?
The problems with posture.
Nice. Okay. What is the best piece of work-related advice you've ever been given?
Keep it simple.
Nice. And that's a very simple piece of advice. I like it. Who would be your ultimate podcast guest?
Oh, that's a good one. Probably Lorimer Moseley for me. I don't,
Nice.
if you ever heard of him, the pain scientist.
Yeah. Okay. Nice. And what are your favorite 3 exercises?
Oh, what do I know? They kind of change from time to time. At the moment, they are heel rainbows. Love a good deadlift, love a good squat. I don't think you can get away from those. But yeah.
So for someone that doesn't know what heel rainbows are, how would you explain that to someone?
So it's like a normal calf raise, but you explore all the different movements in the foot. So basically creating a rainbow with your heel, going from your little toe all the way on the balls of your feet onto your big toe. So it's working pronation, supination, plantar flexion, dorsiflexion. Yeah, that's it. Brilliant. Yeah, perfect. Great for runners, perineals, tib post, gastroc. Brilliant.
Mark, could you just stay there for another 2 or 3 minutes, please?
Give me 20 of those.
Was I exciting you? Do you want me to put some shorts on?
Or leggings?
Mate, I haven't got time. I've got a bloody interview to do.
How bad?
Mike, round 3. Brace yourself.
Okay.
Cats or dogs?
Dogs.
Favorite city you have visited?
Chicago. That's easy.
If you could attend any concert, dead or alive, who would be playing or performing?
Do you know what? I had tickets for Jacko before he died. So it'd be Michael Jackson.
Oh. What was the last TV series that you watched or streamed an episode of?
Sadly, Lucifer. It's a bit of a cheesy one.
That's all right. If you could choose anybody to play you in a movie about your life, who would it be?
From years gone by, people used to say I look like Justin Timberlake. So it's got to be JT.
Yeah, I see a bit of Timberlake in there.
I see that.
Tea or coffee, and how do you take it?
Coffee, espresso.
If I could give you the power of time travel, would you rather go back to speak to your ancestors or forwards to speak to your descendants?
Oh, that's a good one. I think forward. Yeah, I'd like to go. I'd like to go into the future. That'd be ace.
If you thought that one was good, wait till you hear this question. Would you rather shag a goat and nobody will ever know about it?
Yeah.
Or not shag the goat, but everybody will think that you have?
Not shag it and everybody think I have.
It's a popular answer for some reason. Yeah. Final question. Please tell us one thing that is still on your bucket list.
Route 66, driving across America. Yeah.
Beautiful. So if anyone sees Justin Timberlake cycling along Route 66 with Michael Jackson tickets in their hand, it's not really him, it's Mike.
Shimon. Yeah.
Beautiful. Mike, that's it. You're in the 27 club. We know a little bit more about you. And we have got some T-shirts. Although we've been saying this for months, we've just had like a 6-week break where everything that could go wrong has gone wrong. But
blame it on Corona. Blame it on coronavirus.
That's slightly related. I was infected. It wiped me out for a week or two. But yeah, we will send a 27 Club T-shirt your way. So you're one of probably about, I don't know, 17, 18 people, 16 people, Josh?
About that.
I will wear it with pride. Yeah.
Yeah, for about 5 minutes.
Yeah. It'd be a perfect workout T-shirt, that one. That's great.
Yeah, that is true. That is true. Or if you've got like a really bad stain or something and you need to use like a rag to wipe something, you multi-purpose. Perfect. It's made out of the same material that like you get like dishcloths, so you can use it for anything you like.
It's multi-purpose. Brilliant. I like it.
Exactly that. Right, we are stumbling somewhat smoothly into the interview section. Joshua, what is your first question for Mike?
So this is this is a long one, but we need to kind of, establish the backstory, like a good movie. So obviously you said you qualified in the 90s as a personal trainer, and obviously you've got a bunch of qualifications ranging through biomechanics, sports therapy, everything. Where did it all start? What's your journey been so far?
So it started, I think it was because of my dad's background. My dad was in the RAF, so we lived on RAF bases as kids growing up. And the thing that kind of kept because obviously Mark was saying earlier, he's moved a lot in his life, and I did the same in my earlier years. And I've wherever we went, sports was key, and sports brought us together. Mm-hmm. And as soon as I could get into the gyms and go and use the gym. And you basically just picked up the keys from the gatehouse. Your dad could go and open up the gym, and you had a big gym with basketball courts and all the facilities there that you could just use for free. So I've always been around sports and health and fitness. It's ever since I was, 6-7 years old.
Right. So how did that then kind of evolve eventually into you becoming a personal trainer?
I didn't really know what to do, to be honest. And I was a straight C student at school, and I don't know, I just kind of bumbled along with it without really knowing where I wanted to go, and no real advice about what to do either. I think if I had my time again, I'd probably take a different path. But I wanted to do something that I enjoyed, because that's what everyone says, isn't it? Well, just pick a course you enjoy. So I did, and it turned into a career. So,
and then, so after how long as a personal trainer did you then decide, right, I want to pivot again and go maybe towards the therapy route?
So the decision there was because PT back in the 90s, well, it wasn't really PT. We did training with people on the gym floor as part of our shift. So we didn't actually get paid anymore for it. It was just part of what we did. And the PT world only really started to kind of form as it is now, probably mid 2000s, around that kind of time. So in the late 90s, I shifted from gym floor into running health clubs. So I went management, and then the management side, I was just stuck in an office. So I decided then to come around again and then retrain into therapy. And so it was around about the early 2000s, after I'd been running health clubs for a bit. I just got bored of it and missed interacting with people.
Yeah, I think that makes a lot of sense. I've heard that from a lot of PTs, especially PTs that have gone into management and they absolutely hate it. And I did it for a little while as a deputy manager and stuff, and it's just shit, isn't it? I don't want to do rotors. I want to do deadlifts.
Yeah, exactly. Yeah. You're stuck at, like, people going, how many sales have you done? You go, I've done 2 today. You need to do more. I know I do. And it's just that same conversation every day. It's just, it's no fun.
It's a lot of pressure, isn't it? So how would you define kind of what you do now? What are you, more of an educator, or are you still a therapist? Do you still run clinics?
Yeah, a bit both really. So I do 2 days a week in clinic, and the rest of the time I focus on education. And I think it's that old thing, isn't it? That those that can do and those that can't teach. And I like to be a bit in between. So I think I hopefully still can, and I prove that I can by doing it. And then I learn from my patients how to teach, because everything that comes through, everything that's new, I try to implement in the clinic. And then I use that experience then to help learners with progressing what they do with their patients or clients.
Right. So if somebody wanted to follow from moving from personal training into some sort of, sports therapy or manual therapy, whatever, what would be your kind of recommended roadmap? Where would you point them to?
I think it depends on what they want to do. So I get this question a lot, and because a lot of people say, "Oh, I want to be a physio, or I want to be an osteo," and or they want to do that course. Mm-hmm. So I want to do a physiotherapy degree, they'll say, and I'll go, "Well, do you want to be a physio?" And they go, "Well, no, not really." So, well, where do you want to go? Where do you want to end up? Because if you want to be a physio, you have to do a physio degree. If you want to be called an osteopath, you have to do osteopathy. But if you're not really bothered about those titles, there's loads of different ways to get into sports therapy or sort of manual therapy in general. So if you want to do more rehab side, you need to choose a rehab focused course. If you want to do mainly manual therapy, then there's loads of soft tissue courses out there. But I think the confusion is that a lot of people think the soft tissue quals are rehab quals, and that they're very different. And the soft tissue stuff you can do with like the North London School, the London School of Sports Massage, Oxford School, the Cambridge School. There's loads of them out there. They're very good courses for teaching you soft tissue skills, and you'll be a very good hands-on therapist. But how to deal with tendinopathies, how to progress and regress exercises, all of that kind of stuff is in there, but the focus isn't that on those courses. It kind of alludes to it. So you need to have a look at the syllabus for the course, and who's delivering the course, what all the modules are, and whether they fit into where you want to go. So it's a minefield out there. It really is. There's so many different options. It's really confusing.
Yeah, I think it makes sense. Like, obviously, we run level 3 and level 4 sports massage therapy, and we've had people that have finished our course and they're like, right, I'm going to go and be a physio now. And I was like, no, that's not how it works. You missed a couple of steps. With your career so far, who have been your biggest influences, like kind of educationally and the way you do your practice and everything?
Major guy was or is still Martin Haynes, who started up the kind of beginnings of biomechanics education. So I've been working with him now since about 2006, 2007.
Nice.
And I helped write it's kind of adapt what he'd already done into where the biomechanics education program is now. So I'm Rachel's obviously taking it on from my input, but I tried to because I was an educator, so I was trained as a teacher. So I tried to make it I made it aligned to all the level 4 criteria, so that it could get accredited, and that was back in the late 2008, 2009 kind of time.
Nice.
So, Martin's been a big influence, and I still work with him now. We do a lot of consultation work now.
I spoke to him probably 2 weeks ago, I think, because
cool.
I've been injured for 5 weeks, and he basically thinks one of my intervertebral discs became inflamed.
Okay.
So, they've given me some stuff to do, and then I've had an MRI on it, and he's been checking out all my images and stuff. So he's a really good guy, super knowledgeable as well.
Oh yeah, brilliant.
Yeah,
really good.
So Mark, I'm going to hand over to you for a sec, just because I'm asking all the questions.
No, that's all right, mate. I was happy listening. I forgot that I was even involved. I was like, oh, this YouTube video is really good that I'll watch it. Oh shit, it's talking to me. Mike, this might be a complicated question, but I don't know. In my head, it's brilliant, but I don't know how it's going to come out. So if we imagine most people listening to this will probably be personal trainers, of which you have a great deal of experience, but there's going to be other fitness professionals and therapists, et cetera, that sort of weasel their way in. And I think it will cross over to pretty much any fitness professional. But if you imagine, I'm thinking of becoming a personal trainer, so I've not yet entered the industry, and in front of me is a ladder. At the bottom of that ladder is me now at entry level, and the top of the ladder is me being a really successful personal trainer. And in the middle, at every different step of the ladder is a different sort of level of knowledge or something I should be implementing. Whereabouts on that ladder does anatomy sit?
Definitely towards the bottom.
Right.
I think it's got to be some of the first things that you learn. Well, it is, isn't it? It's on the level 2 course, on the level 3 course. It's your first modules, first units. And I think it's right that it's there. I think the only problem is, though, that the way that it's delivered, and it's not the teacher's fault. I think, again, it's the syllabus fault, is that we focus too much on muscles rather than movement. So we need to know the muscles for sure. But once you know that, you then need to know how they influence movement and how muscles work in different ways. Because it's always okay, there are three things that a muscle does: eccentric, and then concentric, and then isometric. And we learn it very simply in those terms. And I think we rather than the exams being you need to do an exercise on this machine or using this piece of equipment, it should be you need to do an exercise for horizontal adduction. Off you go. Because that's the way gyms are now. They're very different to the old, where there are pieces of equipment for everything, with CrossFit coming in, all the kind of functional training gyms, that kind of stuff. There are no machines in some gyms, yet that's all some of the courses teach you is on machines. So you need to learn the movements rather than the machines. So, and to know that, you've got to know anatomy. So I think it's definitely some of the first things.
Yeah, I was hoping and I assumed that would be your answer. And I suppose the point I'm trying to get across to the listeners, and I will admit this quite openly, is that I'm a decent PT, I'm a good coach, but anatomy and physiology is 100% my Achilles heel. I think it's probably the area that has held me back in terms of I've still done all right for myself, but have I done as well as I could have done if my understanding of the body was better? And the answer is unequivocally no, I haven't. So I would assume there would be a hell of a lot, probably the majority of people listening to this would be in the same boat, where they've skimmed through, they've like blagged their level 2, level 3 anatomy exam, passed it by 1%, and then put it to one side. Now I need to learn about all the different deadlift variations and how to teach a barbell snatch and stuff like that. So I just wanted to hear from you about sort of the importance of it. And if you imagine, say like the anatomy is that bottom layer, that foundation level of that ladder I was talking about. If I've skipped across that bottom step and I've blagged it, I've cheated on my exam, or I've copied someone else, or I've just guessed and blagged it by one pass mark, what is the knock-on effect then as I get higher and higher up that ladder and I get 5, 10, 15 years into my career, if I haven't thoroughly understood anatomy or I don't have a very good understanding of it, what impact does that have on my business?
That's a really good question. I think it was that you're the same as me, mate, and that's why I did what I did, because I found elements of anatomy tough. And I think in my earlier days, when I was trying to, so the knock-on effect it will have is when you have that client that isn't able to do what you think they should, and then you don't know why, and you don't know how to adapt it. And knowing the anatomy in general, but then also the variations that there are in anatomy, can really help you work out a different way of working with that person. So for me, it would have probably been, you would have tried to get someone to do something, they can't do it, but you don't know how to change it, so you carry on doing it, and then they hurt, and then they leave. Yeah, so it's not being able to adapt to the individual will be a big problem if you don't know it well.
Yeah. So if I sort of put that into context of like a real world example, would it be fair to say, let's say for example, I've got a client this afternoon, so I'm busy Googling like really hardcore exercises so I can fuck them up. and I come across, say, walking lunges. I go, right, Sharon, we're doing walking lunges, the length of the gym, and Sharon's losing balance. She can't keep upright. And because I think I'm a brilliant coach, I say, right, instead of a walking lunge, we'll do a stationary lunge. And she still can't do it. She's still got pain. So because I'm such a brilliant coach, I'll then go, right, instead of doing that lunge, we'll do a split squat. And we've regressed it again, and she's still struggling. So I say, right, well, now, what's the problem now? Where do I go? Is that sort of where, like, if I understood the anatomy better, I would be able to see what it is about the way she moves that is causing her to struggle with that movement that I'm giving her. Does that make sense?
Yeah, it does. Yeah, absolutely. I think, yeah. So, I mean, you've just described someone that came to me about 6 weeks ago.
Right.
So, yeah, she had exactly the same problem. She had problems with her knees because her previous PT was getting her to do walking lunges loaded. And it was really hurting her knees, and she was just told to power through it and stop being a wuss and all that kind of stuff. So we regressed her right back. And the problem was, so because I'm able to assess where it was her patellar tendon that was aggravated. So we think that she had a patellar tendinopathy where the tendon gets a bit overloaded. So it becomes reactive and a bit painful. And so you still need to exercise that tendon because rest is no good for tendinopathies. It's kind of like a Goldilocks. It doesn't like too much. It doesn't like not enough. So you need to find that bit in the middle. So we still needed to work it, but in a way where she could tolerate it. And yeah, we regressed that right back, exactly like you said. And we started using yoga blocks. And the problem was that she was, and this isn't a problem all the time. So she was drifting forward on her knee, which was overloading her front knee, which was causing the problem with the patellar tendon. That was my theory with it. That's only a problem when it's sore. So some people play sports or do activities where it requires the knee to be in that position, and then you need to condition it to be in that position. So the position itself is not bad, but it's when something's aggravated, then we need to back it off. So I guess it's a bit of knowing anatomy, but also a bit of biomechanics, and then a bit of pathology as well. So understanding the process that the tendon goes through. So but the anatomy again is the underpinning bit of everything. Because I mean, for me, I need to feel around her knee and I need to assess stuff and go, right, is that bit sore? Is that bit sore? Is that where you feel your pain? And knowing the anatomy, I'll go, right, okay, I know exactly what that is, and then what we need to do about it. So it's it is a bit of a combination, but the anatomy definitely is the underpinning for all of it.
The more we speak to people like you, the more I start to think, like, how the fuck are we allowed to have personal trainers? Like, how am I allowed to take a person and make them do stuff when there's, like, literally the tip of the iceberg is all that I know about the body? And even when you talk to people who are experts in specific niche areas such as anatomy, or it might be business, it might be Olympic lifting, when you speak to the people at the top of the education game in those fields, even the things that what they know is still not much bigger than the tip of the iceberg of what there is to know. And then it just sort of makes you wonder, like, how on earth is someone allowed to do a 2-week course and then go and get unlimited amount of clients and make them just randomly do shit? It's weird, isn't it?
It's crazy. I mean, I used to teach level 3 courses, and the way that I did it was I said, right, you do your level 2 and then you have to work a year on gym floor before you can do your level 3. And then nobody signed up to the level 3 because they didn't want to do the year on gym floor.
Yeah,
so
it's too hard. Takes
exactly,
too long.
Yeah. Which I think is the route that you have to take that route. And I mean, yeah, that's kind of where I've come from. So that's probably my bias and why I think that. But it's you get so much good experience by communicating with people at that lower level, and then but also having if you've got that system where you've got your level 2s doing all the gym floor work, I mean, level 2 doesn't even really exist anymore, does it? Everybody jumps straight into level 3. So, but really we need that tiered system in the gym where you've got those experienced trainers helping the guys that are new. So, and they can observe those experienced guys and what they're doing, and then come on the course and then realize why they're doing what they're doing. And but it's just not there. It's a real shame.
Like an apprenticeship that you would see in any other trade, whether it's an electrician or carpentry. There's no electrician that just goes for a Monday to Friday course and then he rocks up at your house on Saturday to rewire your whole house. Like you're not going to let him do it, are you?
No,
something that could fucking kill you if he hasn't like put your light switches in safely. But he's cheap and he's nice, so yeah, sod it. We'll give him.
And he's got the piece of paper. Yeah, he's passed the course.
A piece of paper is a piece of paper is a piece of paper. Like in some people's eyes. Yeah. Like Mike, this is probably an unanswerable question, but what percentage of all of anatomy do you think you are comfortable with, that you know?
I'm pretty good with musculoskeletal anatomy.
Yeah.
I would probably say probably about 70-80% of that. There are still things that I if I'm delivering a lecture, I will still get the books out and revise things and go, oh, blooming it, I've forgotten that. Because there's things that you use all the time and there's things that you don't. And but in terms of other anatomy, like visceral anatomy, those kind of things, that's probably more like 50%. Mm-hmm. So yeah, musculoskeletal a little bit higher, and then everything else a little bit lower. But I would class the clinical anatomists that do the dissections day in, day out. Those guys are 95-100%. They're dealing with it every day. I don't do that. So yeah, definitely around that 70-80%.
And the point I'm trying to make here is that Joe Bloggs, the PT, who got 1% more than the pass mark on his anatomy exam, thinks and speaks as if he knows 100% of everything there is to know about anatomy. No. In actual fact, he or she probably doesn't. With what you know about the level 2 and level 3, and I know different education providers will have differing like levels at which they teach it, but what percentage roughly of anatomy would a graduate of a level 2 and 3 come out of, in terms of if you're at 70-80%, the guys teaching on the cadavers are at 95, pushing for 100, how far behind are the fresh level 2, level 3 students?
Without doing them a disservice, probably 10-15.
10-15, yeah. And if you were to do them a disservice?
I say a solid 10.
Single digits.
Yeah, because the thing is, right, on the level 2, you learn front of your thighs, quads, pretty much. Level 3, you learn that there are 4 quads.
Hang on, I just need to write this down.
But there's actually 5 quads anyway. So but yeah, there's the 4 quads. And then on the level 3, you'll learn, okay, so this muscle goes from here to here, but then you don't really delve into the intricacies of how the different muscles, the different directions of the fibers, the different structure of the muscles, that musculotendinous junction where they change from the muscle to the tendon tendon properties versus the muscle properties. There's so many little niches, and so my clinical anatomy, I did 2 years study on pec minor.
Wow.
And I dissected 20 shoulders and 2 years for pec minor. But that's the level of detail you go into. You look at the histology of the muscle, what it looks like under a microscope, and the different variations of the attachment, and then the implications of that, if they are differing, the pathologies that relate to that as well. And that's just one muscle. Imagine doing that for all of them. It's so that just shows you the kind of superficial layer that we have, really.
And again, I know I apologize for asking you to add a numerical value to something that's completely plugged out thin air. The point I'm trying to get across is that so many PTs are underprepared to be able to really maximize what they can achieve with the client. And nowadays, social media and fucking business gurus and entrepreneurs, we've got more of them than we've got PTs. There's one. It's too easy for a PT to think that the problem is I need to improve my copywriting so I write a better post that gets more attention, or I need to improve my graphic design so I make a better picture on Canva to get people's attention, or I need to be more argumentative by slagging off everybody else in my area to make me look like I'm better or different. And in actual fact, I genuinely believe if you want to make more money as a personal trainer, go back to the very beginning and get better at understanding the key foundation principles of your job, and then coach people better. Because if you can help someone better, and if you can, like the lady you talked about with the lunges, she might have been to see 4 or 5 PTs, and if one of them loves Olympic lifting, they will have got her doing barbell snatches and her knee would have hurt. If one of them loved insanity, they would have got her doing HIIT sessions and her knee would have still hurt. And she would have just gone from one type of training to another and never really addressed the actual mechanical issue that was probably not impossible to fix. You just had to know what you were looking for. Like a mechanic looking at a car. Like, you don't just go and rag a car around different racetracks. You stop and you get someone who knows how to sort of fix the engine, like the stuff under the bonnet that you can't see. And I just think PTs would make so much more money by addressing those things. And then that person who's now seen 5 PTs and nothing's ever worked, she's going to fucking scream from the rooftops that I've seen this person, it cost me 60 quid, not 40 quid, but I've slept pain-free for the first time in years. And that's, it's invaluable, isn't it?
Absolutely. Yeah, definitely. And I mean, that same woman had plantar fasciitis for, I think it was about 4 or 5 years. And continuously doing HIIT training, which is not great for plantar fasciitis. And she's been training with me now since the turn of the year, so nearly 8 weeks. Plantar fasciitis is gone. Wow. It's just not there anymore. We've adopted a completely different approach. We've taken into consideration her previous history, what she was having problems with. And the thing is, the plantar fasciitis was stopping her running, which she really loved. And now she's running again. She ran 5K the other day. So these things can have a massive impact on people's lives. And, we've got that person for an hour or whatever, but you've got to think about the impact your hour session has on the rest of their working week. Now, if they're struggling to walk because of plantar fasciitis and, you keep on smashing the hell out of them doing bounding work, then, it's that, and hoping that it will change. They're just going to go elsewhere. But just on your point there, Mark, I agree completely. The basics are the key. This isn't complicated stuff. You can make it complicated, and having additional knowledge makes you think about things in a different way. But when you look at a session that I would do with someone, it looks like I'm doing PT. It looks exactly the same. I'm doing the basics. But with the other knowledge that I've got kind of slotting into space, into place. And I work with another lad who's from a PT background, Dan Williams, and he and I, we call ourselves posh PTs. We've done that additional level of training, but actually the big thing that I've one of the most important qualification I did was my level 3 PT, because that, like I said at the beginning, that was the coaching aspect of what I do. And that's huge, that you can't take that away. PTs are great at that. And that's where sometimes physios aren't so good at the coaching side. They're very good at adapting exercises, but they're not really good at programming. In my experience, some of them are, some of them are not so good. But again, those are elements that the personal trainer will, and the personal training course concentrates on, that sometimes the medical world doesn't. So having the knowledge of the two and then being able to combine them, from someone who's in pain through to performing normal functional activities again, the combination of the medical side and the coaching side works perfectly well. And having those two together is really important. Now, I've worked with guys that work with the top Olympic athletes, and I've watched them work, and they do exactly the same as what you would learn on a level 4 sports massage course. They do the same. It will look the same, but where it's coming from is different. So the skills you learn on those lower courses, level 3 and level 4, are invaluable. And I think we're always after the next thing, aren't we? So in therapy, it's like, okay, now I need to learn needling. Now I need to learn cupping. Now I need to learn tools. In the gym stuff, it's like you said, the HIIT, the insanity. What's the next big thing? The grit stuff, or the Les Mills programs. And you want to learn the next thing, but actually just get good at the basics, and you'll be good.
Yeah, you're definitely preaching to the converted there. Probably because I'm too stupid to understand the complicated stuff. So I've had to settle for the basics, but it's done me all right so far. Mike, moving on slightly. So we've established that anatomy is an important area. And I don't want to sort of now lead into like a plug for a product, but I do want to talk about your Learn Anatomy Online, because the reason I messaged you to ask you to come on as a guest was when I saw a Facebook post about the Anatomy Online sort of product, as it were. Now, correct me if I'm wrong, it might have been going for years and years and years and years. I just only became aware of it probably a couple of months ago. I don't know, it might have been just before Christmas, maybe.
Facebook ads worked.
You what, sorry?
The Facebook ads worked.
Yeah, all that work you've been doing with those business gurus has paid off. I told you that's the most important area. It got my attention, and it looked really good, and obviously because of how I see the kind of the problems that personal trainers have, it instantly solved what I believe to be a massive problem. So my question is, was it always your intention to have an online method of teaching anatomy, or did that come about due to the restrictions of the past 12 months, whereby you had to adapt your business model, as it were, to sort of deliver something in the way that you could?
It was a combination, really.
Right.
I've been delivering stuff online for a while, but mainly to a small group of our students. And then because of COVID, during the first lockdown, I did loads of free webinars. Did 3 a week, so I did a Monday, Wednesday, Friday. And we took a case, and we go, right, okay, this is Joe Blogs, they've got this wrong with them. And then I'll read out the case, and then I go, right, have a think about what it could be. And then on Wednesday, we'll discuss your ideas. And then we got a really good following with that. And then on the last day, on the Friday, we would then go through the anatomy and go, right, okay, this structure here might be called, might be the reason why this is happening. And this is the reasons why this goes wrong here. And people really liked the anatomy that we did. And so it was then that I decided, right, okay, we need to do things online, or we can, because originally I thought online learning was a load of rubbish. And
me too.
I just thought, well, it lacks interactivity. So I've had to really think about how to make things the element where you feel as if you're part of it. And because I didn't want it to be just like me recording a video about a femur on YouTube and then you watch it if you want. I wanted it to be something that people get involved in and could ask questions as well if they're not sure of stuff. So yeah, it came out of lockdown. It's something that I've been meaning to do for a while, but we started on the 30th of November. Yeah, so you literally saw the first sessions that I'd recorded. But it's changed even since then. So
really?
got kind of the equipment now. So I've got decent lighting. I've bought loads of models of real human anatomy as well. I've managed to get hold of some of that. So yeah, we use as much real anatomy on it as possible. So yeah, it's been really good. I think we've got a good cohort that because I do a live session, and then if you miss the live session, they watch on catch up and they ask questions then. So we've got some really good interaction in the group.
Yeah. So just to clarify, because honestly, I'm really interested. I think it's something that even as soon as we finish, I know that I need it to sort of to develop myself, and it's something that I know is an Achilles heel, and I've spent so many years avoiding weaknesses and concentrating on strengths to kid myself that everything's all right. And I've still done all right for myself. You talk about guys working with Olympic athletes, and I've been to the Olympics. I've worked with professional football teams, and the stuff that I've done with those athletes has been the stuff that I do in PT sessions in a Fitness First at 10 o'clock on a Wednesday night. That it's the same, but it's the understanding of it that is, and the understanding of how to sort of specify it to make that person better at something rather than just hoping they get better at something. I think that's probably the key difference, isn't it? And so just to clarify for anyone else who's interested, how does the Learn Anatomy online? How does it work? It's a closed private Facebook group, is that right?
Yeah, that's right.
So you do your webinars in there. You do a live webinar once a week, and
one a week. We do it live on Monday at 10 o'clock and every week. Yeah. And I do it where we layer the body. So we go skeleton first, and it's not just like, I've got one here. It's one I prepared earlier. So we get pelvis. So you would learn on level 2, level 3.
That shows how crap I am. I thought that was a baby elephant.
You definitely need to sign up.
Yeah.
So, you'd learn the ilia and then the sacrum, and you might learn the 3 different sections of the pelvis. But we go through all the little bony points. So what's that point there? What this point is here? What that bit's there? Because then when you know all these bits in here and what the structures are in the hip socket, then you can then start. Well, the next lesson then is all about connective tissue and ligaments. So we go, okay, this ligament goes from here to here, and you can understand the names of them because they're named after the bones. So then we layer those on. Then after the connective tissue, so things like the labrum and the bursa of the different parts of the body, we'll then go into the muscles, and we'll do like a 3D view of the muscles. Got loads of cadaver videos that I use, and then we'll go into the nerve and the blood supply to that region as well. So I've gone from kind of level 2, this is a pelvis, all the way through to kind of first year degree level. This is the blood supply and the nerve supply to that region.
Cool. And so let's say if somebody signed up today, do they start from sort of point 1 and work their way forwards, or do they just keep up to date with whatever topic it is you're working on this week?
Yeah, it depends on their level, really. So when they sign up, there's an intro video at the beginning, because we've got archive videos from all of the previous stuff that we've done. So there's about 50 hours of material on there now, and we've created loads of topics, hashtags that you can in the groups now, and so we've got introduction to anatomy, introduction to bony landmarks. So you can start there if you've never done anything before.
Yeah.
Or you can join in with the live sessions. At the moment, on Monday, we're on week 3 of the hip. So obviously you can watch back week 1 and week 2 and then join in on the Monday. or you can go all the way back to November where we started at the foot, and then you can work your way through those. We recommend it takes about we recommend an hour a week, to an hour and a half a week. So you diarize it, you put it in your diary. That's my anatomy time, because that's what I know I need to focus on. And then because a lot, you know what it's like, that you sign up for something, you know, all guns blazing, and then a few weeks go by and you go, oh damn it, I haven't even looked at anything yet. Yeah. So you've got to diarize it and put that time in. And even if you can't make the live session, you diarize it so that, okay, so on Wednesday at 11, that's my time when I'm going to catch up.
Yeah. I was thinking someone could easily look at that and go, oh yeah, that's interesting. What, 50 hours? Or fuck that. I'll just watch a 7-minute YouTube video instead, something. I said, but that same person is probably also on series 5 of Game of Thrones, and they had no problem spunking 50 hours of their life watching that, and they probably watched that in about 2 weeks, like 3 episodes a day for 2 weeks, because they're engrossed in it. And so I was thinking, well, 50 hours, do like 2 hours a day every day for a month, and you've caught up. And then you've just got to have, then you sort of, that's your binge watching, and then you sort of 1 or 2 hours a week where you sort of actually, I mean, at the minute, while we can't all go out into gyms and we can't go and train people face to face, might as well the commuting time, that even if someone lives 15 minutes from work, like there and back in a day, that's half an hour. That's like 2.5 hours a week they've now not got to travel. Like, use it bloody constructively, people, and like learn something bloody important rather than the latest like business technique or something that you think might be the problem. It might not be. Mike, what's the damage financially on it?
It's $9.99 a month.
Is that it?
Yeah.
Fucking hell. I can't even ask for a discount. Like, that's, I thought you were going to say like 50 quid a month or something like that.
No. I kept it. I wanted to make it accessible, to be honest. And do you know what? It's for me, it's very selfish. You know, I was saying, like, sometimes I have to revise stuff. This is my revision.
Yeah, so and I get you.
Preparing for it every week is making me better.
Yeah.
So, you know,
and I'm saying once it's done once, it's done forever, and you've then built up hundreds of hours of teaching that's going to be able to sort of help people for decades to come, isn't it?
Yeah, exactly.
Yeah, well, in that case, I wasn't going to be blunt about it, but at $9.99 a month, that is a fucking no-brainer for every single person listening to this. Like, even if they go and do it for a couple of months and they binge it and then they sack it off, like, I think it's well worth. I think if they went in with that approach, they would soon see it as a very valuable tool to have ongoing. So yeah, hopefully a lot of people take you up on that. Mike, I've got one more question, and then I will hand back over to Josh. You mentioned cadavers a little while ago, and having sort of, did you say you'd sort of dissected 20 shoulders on cadavers and stuff like that? And I read a Facebook post of yours where you said something along the lines of, and I'm paraphrasing, that you've lost count of how many cadavers you have dissected. And for those who don't know, a cadaver is a dead body. So you've lost count of how many dead bodies you've sort of dissected, and you've never found a knot in a muscle. Is that correct? Do you mean, you know the quote I'm talking about?
Yeah.
So you say you've never found a knot in a muscle, and then you said something along the lines of, don't stop what you're doing to treat a knot in the muscle, but you do need to reframe what you think you're doing or why you think you're doing it. Does that sort of make sense? Have I butchered your...
Yeah. No, not at all. Yeah.
Could you maybe sort of just dissect that slightly for someone someone who might think they've got a knot in their muscle, or they might get clients on a daily basis saying, oh, I've got a knot in my back or something like that. What's the truth?
So the truth as we know it is that you have sore spots in muscles, that's undeniable. I think the reasoning for them from especially 10, 15 years ago has been shown not to be probably not true. I'm using all the probably and likelies because there is no absolutes.
Yeah.
And the major thing that's missing is our understanding of the nervous system when we treat people. So the reason why, I mean, if you're happy and everything's good, life is good, you got loads of money in the bank and your car is full of petrol, you got loads of food in the fridge, you feel great. When everything is the opposite, you feel terrible. And things that may, that are sore spots will start to become more sore because of everything else that's going on in your life. And we try to blame pain and painful areas a lot of the time on the anatomy. And we try to reason it that there were these problems in the muscle. But if you run your fingers along muscles on dead people and they are smooth as anything, unless there's an injury, so that's different. So if there's scar tissue where they've torn the muscle and then the body has repaired it with scar tissue, that's different. That's not what I'm saying. But if there's no injury to that muscle, it's smooth as anything, and it's because the brain ain't working anymore in that dead person, so that there's no activation of that muscle via the nervous system. So somebody's body will protect an area that is painful by creating a contraction, and that's what feels tight. Yeah, so that area will be hypersensitive. Your body will make it sore because it's trying to protect you for whatever reason. Yeah, like I said, the reasons could be multifactorial. So if we only treat the person through their anatomy, we're missing a lot of the problem. So that's what that post was getting at, that we are more than just our anatomy.
See, I remember doing that cadaver day with you. And
oh yeah, I forgot about that.
Right. And I was blown away by the technician's knowledge of anatomy. Like, that was just that next level of understanding and comprehension. It was just fucking unreal. But I was just going to mention, if you ever need more cadavers, me and Mark have set up a side business supplying fresh cadavers.
500 quid each, and we'll get you anyone you want.
That's how it started.
Really?
Did you hear that story, Josh, when you were in the labs? Yeah. So they used to go around killing homeless people and bringing them to the universities and collecting cash for the bodies. And
wow.
just saying,
the 1990s was savage.
That's how it all started. And there, in fact, in King's College, where you went, Josh, there was I think it was the first ever cadaver from like 1880 or something like that, and they've still got it in a jar on the top shelf. I think it was a kid. I think it was a child.
Wow.
Good times.
I tell you, it's a brilliant experience, and it's a real humbling experience as well for someone to donate their body for us to see. I think it's just brilliant, and it's that we don't know what we would do without those donations. So it's but the labs have been closed all year because of what's been going on. So we're getting back in hopefully in June. So
wow.
Looking forward to getting going again.
Next time you've got one running, let me know and we'll spread the word for you, because I'd love to have another one. That was amazing last time.
Brilliant. No, thanks, Josh.
Yeah, I've spoken to a few people, one of which I think might have been Rachel France, who said that it's like the best learning experience they've ever had, in not only in terms of what they learn, but then how that then helps them to implement stuff with their day-to-day their day-to-day business, be that as a PT or as a therapist, as a biomechanics coach, or whatever you call yourself. It's invaluable. It's something I've never done, but I would, gonna have to add it to my list, aren't I?
Yeah, it's brilliant. I think the main thing for me is that when you hear terms like impingement, so impingement was a diagnosis for things, and we're starting to move away from that term now. It's all a bit of semantics, you know, picking the right terms, but things are impinged in your body all the time. And every part of your body, every part of your spine, all around the clavicle, in the shoulder joint, there's impingement all the time. So impingement can't be the problem.
Right.
Yeah. And this is the thing. This is why we're reclassifying terms. Because if you're saying that pain is caused by impingement, then why isn't everybody in pain? Because we all have impingement all the time. So it's really interesting from those cadaver studies that we go, well, you know, there isn't any room there. So why isn't everybody sore? So it's, it really
maybe that's not the actual problem.
Yeah, exactly. Yeah.
Yeah. Well, that kind of leads me on to, I've got my final bit of questioning was almost like a little bit of a quick fire round. And I did it this morning when I was walking the dog, and I was typing in like some of the most common sort of terms or phrases and expressions that I've heard throughout my career. And I was like, sod it, I'm going to throw them all at you, one after the other, to get sort of like a 60-second synopsis on, is it the ridiculous or the sublime? Is it false or true? Which side of what are the truths in it, and what is the bullshit, that as we're now coming to learn more and more? So Josh, if you don't mind, should I do that bit now, just while we're on that topic? Because I didn't have impingement on the list, but I've got a few other things that I'll throw at you if you don't mind. Yep. And as we're going through, Josh, I bet you'll probably be able to come up with a few more. But the first one I've got written down is, here we go. He's got his atlas. I've got that book.
I know, right? Mel Cash.
Pocket atlas. Except mine's unopened. Mike, a slipped disc. You hear people say all the time, I've got a slipped disc. And then I've heard people say that there might be a large percentage of us that permanently have a slipped disc. But what does that term mean? And what's the truth of what we think we understand about it? And what's the actual truth?
Yeah. So when you say slip disc to someone who doesn't really understand the anatomy, you think of the disc literally slipping out from in between the vertebra, and that can't happen. They're firmly, the disc is firmly attached to the end plates of the vertebra, so that it doesn't slip out. What you can have are bulges or herniations, where the nucleus pulposus in the middle, the nuclear material can seep out, and that can cause a chemical irritation, or it can be a mechanical pressure on certain structures. However, everybody over the age of 20 has changes in their discs, in their vertebra, in their facet joints. So as we get older, those changes occur more and more. And we liken it now to when you get wrinkles on your face as you get older, you also get wrinkles on the inside. So if you have back pain and then you go and get a scan and it shows a disc protrusion and you're 50, I'd be surprised if you didn't have one. But quite often then it goes, right, okay, that's the reason for your pain. But you might have had that there for years and it's causing you no bother whatsoever. But now because you have pain for whatever reason, that is, the anatomy is blamed for it. Sometimes it has a part to play, but not so much as we used to think. So that's why a lot of the spinal surgeries now, unless it's a real serious problem, we shy away from those kind of operations, because we know that if we conservatively manage it, in 6 months, it will be better anyway. So why bother opening someone up and causing potentially some other issues. So yeah, the changes in your spine are normal. They're normal part of the aging process, and quite often they will get blamed for pain, and that's it's part of the problem, but not the whole problem.
Yeah. So what about next one? Tight muscles. In particular, something that comes up all the time, I've got tight hamstrings. How much can one person's muscles be tighter than another's, and how much of it is maybe elsewhere, maybe neurological, etc.? What's going on there?
Yep. So the tightness in a muscle can be from an injury. So you can have scar tissue in a muscle if you've torn the muscle. So it will be shorter on when you test the length of it, and you're never going to change that scar. So there's well, it depends what stage it's at. So if it's in early stages, you may have some. You may be able to regain some of the original range, but if they've had a scar there for years, that the collagen type changes over the years, and once it's kind of set, if you like, you're not going to be changing that. So that could be one reason. So what we call fibrotic changes in the muscle, but usually tightness is a perception. So you feel tight after a heavy workout, or a sprint session, doing eccentrics or whatever, and you get that DOMS and tightness of feeling, and that is usually a fatigue induced soreness. So the tightness that you feel is a neurological response to what you've done. So it should subside. Sometimes if you've worked the muscle a little bit too hard, then your body will then try to protect it, and you'll have what's called an upregulation of the muscle. So the nervous system will make that muscle have more contractility. So it will engage the muscle more, so that it doesn't overextend because it's worried about being injured. So it's a protection mechanism. So if you then try to stretch that, it could then try to protect even more and go into spasm even more. So the quick way to find out about things like that is doing a muscle energy technique. So if you know the old PNF, but you would do it very gently. So you do like a 20-30% contraction. After doing a length test, 20-30% contraction, hold it there 20 seconds, see if it changes. If it changes, you know that it's likely to be a neurological change, and that's why it feels tight, is because of the nervous system. Because if it was a structural issue, it wouldn't change.
No.
And then the other thing is the other structures. So using the hamstrings as an example, the sciatic nerve goes down the back of your leg as well, and sometimes you can have what's called mechanosensitivity of the nerve. So the nerve becomes sensitized, so that as you try to elongate and go up into hip flexion, like a hamstring stretch, the nerve will make it feel tight. And again, that tightness is there to protect the nerve. And if you keep forcing it, then your muscles will go into spasm to protect the nerve. So there's loads of reasons why you would feel tight, and not all of them need stretching.
Is there any sort of shred of sort of truth behind the theory that maybe the hamstrings might be tight to prevent the person moving into sort of like a range of movement that the body fears will cause injury? So it's sort of as a sort of protective mechanism to restrict the movement, because maybe at some point in the past it might have facilitated that movement and it's caused an injury. Does that ever happen? Is it possible?
Yeah, definitely. Yeah. So fear avoidance is a big thing with what I deal with. Yeah. So somebody has done a movement and it's been painful in the past. They're fearful about doing it again. So we try to bring about that movement in different ways, so that they can understand that the movement is now not an issue, and we kind of need to get over that fear of doing it. So for example, it might be you bent over to pick something up, and then your back has gone, in inverted commas. So they're fearing then flexion. So we try to then bring about flexion in different ways. So instead of bending forward, we'll bring the knees up to the chest, because that's still hip flexion, but just done bottom up instead of top down. Or we'll do it on their side, or we'll do it supported, or we'll do it on their back supine, where they bring their knees up. You know, we try loads of different ways to bring about that movement that they fear, so that we can show them that you can do it in this direction. So it shows that there's nothing wrong. Yeah. So it's fear of injury and fear of pain are really, really key. And that's, again, that's all the nervous system trying to protect you. Yeah.
Cool. My next one is to do with locking your joints, particularly elbows and knees. So you'll see some schools of thought that you sort of lock the elbow overhead for a Turkish get-up, for example, and then you see other sort of methods of teaching say, oh, you absolutely should not lock the shoulder or the knee because you'll be dead within minutes. Why should and why shouldn't we lock our joints?
I think it's okay to with certain things. I think if you're so what locking the joint will do is it will take the muscular effort away. So you then don't have to work as hard to maintain that position. So you're kind of resting on the passive structures rather than on the active structures. So sometimes that's useful. And I guess it depends on what you're trying to do. I think if you were trying to do a snatch with 200 kilos and you didn't lock out your elbows, you'd be in trouble.
Yeah.
You know, there are times when you have to, but you think of Doris, who just wants to do the shopping. Does she need to do that? Probably not. So it depends on the individual, I guess.
Yeah, but you're going to need a fairly hefty load on a locked elbow to make it just collapse and disintegrate, aren't you? Like, probably thousands of kilos.
Yeah, and that's also where the differences between because you've probably heard about postural problems being an issue, when actually posture is just, it's very personal, very personalized thing, but biomechanics is different. So if you're trying to lift maximally, that obviously you wouldn't just go from zero to lifting really heavy. You would condition the joint to be able to take that load, and making sure that the arm is in the right position, so that the angles of forces that are going through that joint aren't going to put the elbow into a vulnerable position. So as long as all that's okay and you've conditioned it well, no problem. Yeah.
So even if I'm just sort of standing and someone's doing, I don't know, like a stiff leg deadlift as an example, with a 10 kilo bar, locking their knees invariably isn't going to cause like instant death or damage.
No, and not, as long as they don't have any previous injury that would predispose them to something. But no, it's fine.
I suppose. Could that theory stem from maybe if someone who's hypermobile at a joint, then rather than if you or I lock a joint and it's neutral, but if they hyperextend the joint, that obviously opens another can of worms because the forces dissipate elsewhere.
Yeah, absolutely. Yeah. So with that, if you have a normal joint structure and you don't have any laxity in the ligaments, then you'll be fine. Because that's the thing with the positioning of the joint will then wind up the ligaments to hold it into place. Where if you have hypermobility, you don't get that wind up of the ligaments. So then you still then place the forces through the joint surfaces, through the ligaments, because they can't wind up properly, and through the muscle tissue as well. So it's a whole different ball game with hypermobility. I know there's, I mean, to be honest, it's not my area, but I think that there's a lady down on the South Coast, Bonnie Southgate, and she deals a lot with something called Ehlers-Danlos syndrome. I've had a couple of patients with it, but again, it's not my area of expertise, but she'd be a really good contact for people who've got hypermobile clients.
What was her name again?
Bonnie Southgate. She works out of Dorset, I think, Poole in Dorset.
Oh, Paul and I've got a mate there. Yeah. Right, we will hunt her down. Right, Mike, I'm going to give you one more, and then I'm going to give Josh a chance to think of a term as well. And my next one is the amount of times I've had a client say to me, "Yeah, I can't come in for my session today because my back's gone." So, and I'm like, "What? Your whole fucking spinal cord and all the attaching muscles have gone? Shit." You are in trouble. You better not come into training. Obviously, that's not what they mean. What does someone mean when they go, "Oh, my back's gone"?
It's usually a muscle spasm, isn't it? So they've either gone to pick something up, and it's often the thing where they'll go, "Oh, I've been doing this all day, and then I did that all day, and then I just bent down to pick up, do my laces up or pick up something off the floor, and then my back went." And it's that kind of catch muscle spasm, and then feel like you can't move. But I find it well, not funny, but it's weird, isn't it, that we think differently about our back than we do any other part of our body. We get really, really worried about our back, and it is strong as hell. You look at all the structures around the spine, all the muscle around there, but we have this fear around our back, which we probably wouldn't have. They probably still come in to the gym if they tweak their ankle, but because it's their back, they feel that they couldn't. But with my clients, I say, if they give me a call with that, I say, look, if you can make it here, if you can make it to the clinic, this is the perfect time for me to see you, because I can show you the things you can do, and I can give you alternatives to keep you moving. Because over the phone or doing things online, it's really difficult to help people out. But if they can get into the clinic, then that, for me, that's the perfect time.
And I suppose the lesson there is, from a commercial perspective, even if somebody is a money-grabbing fitness professional, that is the perfect opportunity to not lose revenue. Because if someone's doing 2-3 PT sessions a week and their back went, so they can't train for a week, well, you either then don't get paid, or you have to extend their training for a week, so you don't get paid for a week longer. Whereas if you can get them in and show expertise in your understanding of the body and how to minimize or reduce the problems they're suffering, now you're worth treble what they're paying you, and they're going to tell a hell of a lot more people as well. You're actually doing your job. You're not just throwing exercises at them. You're actually doing the job that we're supposed to be doing.
Exactly. Yeah, absolutely. And I think key point to that as well is, if it is lower back, then there'll be some key questions that I'd want to ask to make sure it's nothing nasty. And then once all that is cleared out the way, so kind of we've got red flags are cleared, then come on in. Because if it's a red flag, obviously then you don't even come in. But if it isn't, then come on in. Let me show you what to do. And I've had it before where people have said exactly that, and then we've got them in, we've managed to get them moving, and then the next day they're fine. Whereas if they'd have stayed at home and just gone to bed or been on the sofa, dosed up on paracetamol, then it probably would have lasted a little bit longer. But most things need movement. So usually, if things are ruptured, things are broken, they need some time out. Well, it depends on where it is. If you've broken your little toe, you can still come to the gym. But if things are ruptured, things are broken, you probably need a bit of time out, and depending on where it is. But if it's not those things, movement is the best thing for it. Let's get you in.
Cool. Josh, have you got any sort of common? Oh, he's nodding. Go on, fire away.
So I host the level 3 sports massage and level 4 sports massage, but one thing that I've always kind of questioned, and I'd like to get your opinion on it, is when they say during massage that certain techniques like rolling the skin will get rid of lactic acid and scar tissue, and then will massage, it's kind of same question but separate, will massage help remove lymph fluid and move it towards the lymph nodes and stuff, or is it just kind of something that's a misbelief?
So let's go scar tissue. First of all, if you're in the early stages of an injury, then you can have an effect with external forces. So whether you're using your hands or whether you're using a tool, on fibroblast activity. So it will increase the collagen production in that area. It's been done on rats. So there's been no human studies. So we're assuming that it would be the same on humans as well. But that there is clear evidence on rats that using manual therapy helps to produce collagen. Okay. So however, if you just left them alone, so when they used the study on these rats, they did it over a 6-week period, and they did some that they just left and some that they treated. After 6 weeks, they both ended up the same.
Oh.
Okay. So it didn't matter about the intervention. So my argument there is, if you need to get a player back quicker into training, so if you've got a pro athlete, it's probably a good idea to do some manual therapy to help stimulate fibroblast activity. But if you've got a Joe Bloggs who's not so bothered and wants to take it steady, after 6 weeks, it's probably going to be the same outcome anyway. Okay, so that's the kind of evidence that's out there at the moment for ligament healing. In terms of lactic acid, we always think that lactic acid is the enemy, and it's not. It's also used as a fuel, but there's no good evidence that manual therapy flushes out lactic acid. That's what your liver is for. Nice. It does a pretty good job of it, and there's been some studies on it where they've measured blood lactate. I think it was done on the forearm, and what they showed was that after some manual therapy onto the forearm, the lactic acid levels actually increased.
Oh.
So it was the opposite. But then there's been some studies where it has decreased. So it's a bit mixed. Yeah, we don't really know for sure. But then also, why would we want to? Because it's a naturally occurring process. We always used to think, I think, that lactic acid caused DOMS. And that's the big misconception, because it doesn't. Is that the DOMS, we think, is caused by localized inflammation. So, and that's what causes that ache in the muscles, and that makes sense, because when you exercise and then you cause that micro irritation, and then your body adapts and gets stronger. So, but we always, well, I did anyway, when I first started, I was told it was lactic acid that was causing that, and it's unlikely to be the case. If we think about all manual therapy, the only thing we can touch is the skin. That's it. Yeah. So any effect we're having on the tissue underneath can only be via the skin, and it makes and the skin. So when you're an embryo, when you're a baby in your mom's tummy, you're 3 layers of tissue. You've got an ectoderm, an endoderm, and a mesoderm. So you're like three layers, and the ectoderm layer is your nervous system, and then it wraps around your whole body to become your skin. So your skin is a direct link into your brain. So by touching someone using manual therapy, you're touching the skin, affecting the nerves. That then goes into the nervous system and changes the way you feel. Okay, so these are the explanations now that we think are more reliable than the old, when we touch the skin, we change tissue. Mm-hmm. Yeah. So and we think we're breaking things down. It feels better, and this was the point you made earlier before, Mark, about the knots. So if I treat someone who's got a sore spot and it feels like a knot, and then afterwards they feel better, it's not because I've changed the anatomy. I've changed the feeling through the nervous system.
Yeah. So potentially it's a huge placebo, which isn't a problem if it makes them feel better. If neurologically they now don't feel a problem, that's going to help them perform better, whether they're a professional athlete or Joe Public playing with the kids or doing the shopping sort of thing.
Yeah. I think the thing that damages people is the poor narratives, is the poor stories. It's because if you think that someone is breaking down some scar tissue in your leg, I mean, like the IT band is a classic one. So you said about foam rolling. So the IT band can take 460 kilos of shear force. So pulling it end to end, before it deforms by 1%. So wow. If we apply pressure onto someone's IT band with a foam roller, there is nowhere near that amount of force going through that IT band. So it is a tough structure. It also needs to be tight because it stores elastic energy to allow us to propel ourselves. So it has to be solid. So why would we want to make it loose? But it may feel sore. Okay, and often I think it's probably the vastus lateralis muscle rather than the IT band itself. But if that area feels sore, touching it in a way that doesn't hurt should change the symptoms. So it's a symptom modifier rather than a structure changer. I think.
Cool. Josh, have you got another one?
The other one was the lymph fluid. So can we directly influence that?
Yeah, so if you have lymphedema, then yes, there's good evidence for that. And there are courses that are held, they're done by the NHS in manual lymphatic drainage. So someone who's had lymph ducts removed after a mastectomy, so if they've had breast cancer, the arm just swells up because they've got no lymph ducts in the armpit. So manual lymphatic drainage can really help in that kind of with that kind of condition. But if your normal healthy circulatory system is good, it probably won't have that much of an effect.
Okay.
Would it be fair to say you need it to be tight, your IBT band?
Yeah, definitely. Yeah. Same with the plantar fascia. It needs to be because it's an elastic store of energy. If we didn't have that tightness in that tissue, then we'd have to use a lot more muscular effort.
Cool. Mike, I have a confession. I did a bit of exercise yesterday and one of my knees went over my toes.
Careful.
How long do I have to live?
I think it's imminent death, I think. It's just not a problem. Again, it's about conditioning. So you can, and tolerance of the tissue. So if you're, it's the same as a valgus knee position where the knees come in and we go, oh yeah, you shouldn't be doing that. That's really bad. If you look at footballers, you look at basketball player, anybody that changes direction, you have to go into a valgus knee position. It's just whether the tissues have enough tolerance to withstand those forces. So in my mind, if you've got that kind of person, you have to train them with their knee over their toe. You have to train them into knee valgus because you need to prepare them for their sport. So I think those things are really key.
Makes sense.
You're lucky.
Mark, you could have been one of our cadavers.
Mate, well, that's what I was thinking as we were going. I was thinking, shit, I'll write my will down and my final thoughts, and then I'll off to King's College to jump in the morgue. It's nice to know that I've probably got a few weeks left. Thank God for that. Mike, I've got two more, and we kind of touched on both of them throughout this. So you can do it. You can give it like a bit more. You can skirt over it if you want to. But I've got written down stretching. What the fuck? When I was at school, I used to fucking smash a game of football for like an hour every lunchtime, 5 times a week for 7 years at secondary school. I never warmed up once. I never cooled down once. And I was on fire. Like, I literally couldn't stop scoring goals. Stretching, is it good? Is it bad? Like, there's mixed, like, there's some people sort of say you have to do static stretching in particular, I'm referring to after exercise. But is there, I'll be honest, I've played rugby for this should be my 23rd, 24th season of senior rugby. I've never stretched statically once, and I've pulled one muscle in my entire life. So static stretching post exercise, what's the crack?
If you've got time to do it, then go for it. It's not going to cause you any harm, but it's not going to do you any good. The only way you can improve flexibility through stretching is by doing it repeatedly for months, and then you will eventually change the structure of the tissue, because the tissue will try to adapt. And I think it's called Sarcomere Genesis, I think. So you know the sarcomeres in the muscle, you basically grow new sarcomeres. But the much more efficient way of doing that is eccentric loading.
Cool.
So if I was going to choose one of the two, I'd choose eccentrics.
Okay. So you're saying that my hamstrings aren't going to get longer in 30 to 60 seconds when I finish playing rugby?
Sorry, no.
Okay. The last little thing that I've got, and again, you've alluded to this a few times, and it's posture. So you hear sort of, he's got good posture, she's got bad posture. People that think sitting down all the time affects their posture. How much of it is true? How much of that is false? And how much can I, as a practitioner, think or claim that I can change someone's posture?
Yeah. So again, the evidence behind that is really poor. So in terms of a posture is bad for you or good for you, it's about capacity and load. So if you, I mean, we've all had to adapt, haven't we, to online stuff. So we've been sitting in front of a computer for a lot longer than normal. At the beginning of lockdown, my back and my thoracics were aching like mad because they're just not used to it. But now they're kind of used to it. So, and it's like training. So if you do a bench press for the first time, you lift the bar and then you adapt to that load and then you start putting weights on. And it's exactly the same with sitting. So if you are not used to sitting and then you sit for a long period of time, then that can cause you some problems. The main problem is the lack of variability. So the way that I do this, describe this with my patients, clients, is if I asked you to get a bag of sugar and hold it out to the side for 8 hours without moving, how would your shoulder feel? And they go, well, it would be pretty achy. I'm like, yeah, exactly. So why do you think that sitting at a desk for 8 hours is affecting all the muscles at the back of your head and your neck? Because if you don't move around and you don't change the position you're in frequently enough, then your muscles will start to fatigue. And it's a muscle fatigue issue. So then when people then do their exercises in the gym and they're focusing on retraction, you're not going to change that person's physical structure of their spine, but you will improve the fatigue resistance of those muscles because the muscles are getting stronger. So the improvements that they have are not because you've changed their posture, but because you've improved the muscular endurance of those postural muscles. And again, another thing I say, right, okay, so this position here is really bad, but what about if I sat with a book on my head and had perfect posture for 8 hours? All that would do is ache a whole load of other muscles. So it's the duration, the capacity that person has got, and the lack of variety in the movements that's the problem, not the posture itself.
Cool. Another unanswerable question based on what you've just said is that, let's say typical client sits at a desk for say 8 hours, 9 hours at work. How much time would it take for them to move to sort of negate the negative aspect of having sat down? Like, is 10 minutes good, like, if they're doing constructive things, or would it need to be half an hour? What? And I know it's a very difficult open-ended question.
I think literally just standing up and walking around and then sitting back down again is probably enough. What I do with my guys is I get them to set a timer for 30 minutes and then they there we go. And 30 minutes, get up, grab a drink, come back again, and then get back to it again. And that's often enough. When you're held in a position for a long period of time, your ligamentous structures, it's called creep. They start to creep. So, and because they're adapting to that new position. But as soon as you get up and move around again, they'll all go back to normal, if you like. If we can get people up and moving around, even just for a couple of seconds, then that's really good.
Cool. Okay, so and that can be little and often throughout the day. So I suppose from a PT's perspective, if I'm coaching someone, typical client wants to lose weight, but they've had a sedentary job. If I've done a good job of coaching them to understand things like neat calories and activity and looking for an excuse to get away from their desks, like if I don't know, Sharon comes round and makes everyone a cup of coffee at 11 o'clock every morning and you just stay at your desk and take the drink, then maybe can you be the person that goes and makes a drink? And just something simple like that every hour, couple of hours, just getting away from the desk to go and speak to somebody rather than calling them when you can see them in the office. Like basic things that we could be implementing with our clients will actually help with those postural bad things that happen to us from being sedentary.
Yeah, I agree completely. And another one is taxi drivers. So if you've got a taxi driver sat in his cab all day, the best thing to do is every new fare you get up and you open the door for your new fare and then you get back in again. Obviously, I'm socially distanced at the moment, but that it's going to increase your likelihood of tips. And it also gets you up and about and not sat in your car all day.
It's funny you should say that because I'm currently on series 7 of a thing called Fake Taxi, and the taxi driver gets out and he gets in the back every single episode, and then so he must have heard you speak.
There you go. Yeah, you definitely need to spend your time on My Anatomy rather than Fake Taxi.
That explains why my forearm needs lots of massage as well. Josh, have you got last couple of minutes of the interview bit, Mike? And Josh, you got your final questions? Anything lined up? I do have one more short one. Sorry, Mike.
That's all right.
So I'll get my last question in now. So, if you had to recommend any resources, I think there's only one that we've already spoken about. It's already down here at the bottom of your picture. So tie in with that. If people want to get in touch with you and they want to sign up to your courses, where would they go?
The Learn Anatomy Online is a tiny bit of the movement therapy diploma.
Yep.
And which is mte.education. I've been running kind of sports therapy courses for about 15 years. And this course is an amalgamation of all of those. So I've taught the level 3, the level 4, and then went on to degree. And then I taught on some master's football rehab programs as well. And I kind of took snippets from all of it. And we sit after a level 4 and before degree. Okay, so we do a little bit of the manual therapy stuff, but that and we cover all of the kind of techniques that you would learn on a level 4. But we try to bridge the gap between that manual therapy and the clinical world, so that if you need to speak to a physio, you need to speak to a doctor, then you understand what they need, and also understands the perception they have of manual therapy, so that we can phrase things in a way where you look like you know what you're talking about, rather than they kind of poo-pooing what you're doing because the narrative is outdated. So we constantly evolve in the course. We teach lots of clinical skills that you would normally get on first year of a degree program. So So that and Learn Anatomy Online is included in the movement therapy diploma. So all of our diploma students, they get their anatomy delivered to them every week.
Nice. Okay, awesome. So then,
sorry, Josh.
I was just going to say, if somebody wanted to reach out to you on social media, where would be the best places for them to go?
I've only just started on Instagram. I'm a bit older than you guys. I think I just didn't get Instagram. It took me a while to get Twitter, but on Instagram we're at Movement Therapy Education. Just started to do stuff on there. On Twitter it's at BHAM Movement because my clinic's Birmingham Movement, and then on Facebook it's Movement Therapy Education. Yeah, we've got a group on there as well.
Nice. Go for it, Mark.
Mate, my last little bit was perfectly linked to what you were just talking about. I've seen you say that on the diploma you don't teach techniques, you teach concepts, and that sort of ties in with a lot of stuff that I find myself talking to PTs about. Although I sort of say to them, I don't teach them methods, I teach them principles. So I dare say it's a similar sort of thing, but just in your own words briefly, for someone listening to this, what's the difference between a technique and a concept, and why is it important for a personal trainer to understand the difference between the two?
So from a manual therapy point of view, we used to go on courses to learn new techniques from people, and we'll go, right, okay, you do this technique for this muscle, and you do this technique for this muscle, and you press here and you do that, and you're kind of desperately writing down notes and going, where did they put their hand, where was it? And you don't need to do that, because if you know how a technique works, you understand the nervous system, you understand the anatomy, you understand pain, and relating it to that individual, you can adapt any technique for anybody at any time. So then you make your treatment plan, you make your rehab plan specific for that individual. Because if you just learn recipes and the recipe doesn't fit, you're in trouble, because you won't be able to work out what to do with that person. So it's those building blocks, those underpinning things that make sure that you can work it out for yourself. That I think that's hopefully that's it in a nutshell.
Which comes back to where we started at the beginning, is that basic foundation level of understanding of why you're doing what you're doing. And the better understanding you have of that, all of the bells and the whistles and the cherries on the top and the sexy bits, they take care of themselves as and when you need them, don't they?
Yeah, exactly. Yeah, it's funny. So in terms of the marketing side, after the 2016 games, I think it was 2016, when Michael Phelps had all those marks over him, and then cupping just went mental. So loads of people were looking for cupping therapy, and they're going, oh yeah, well, if Michael Phelps used it, it must be good. But only really now has the research come out, of the Western research anyway, around cupping and what it does, and the plausible arguments for it. And but people would have jumped on the cupping bandwagon to get people into their clinic, because that's what was in the media, without really understanding what it does. They would just go through the technique. So now we understand a little bit more about what that does. So because this is the thing, people don't tend to look for on Google the basics. They look for the sexy stuff. So you might use that stuff to get people in, and we may even do a little bit of that treatment, but all the time we're working on those underpinning things, because we need to educate the clients and educate the patients as well, so that they realize what's going to work. So cupping isn't going to solve all your problems, but we may have to work on some other things after we've, worked out what's going on with you. But it's the hook that's going to get them in. And that's where the techniques sit. I think that they, in terms of kind of business strategy, they're the hooks to get people in to inquire about what you do. And then you then work out when's a good time to have a look at their belief system and bring in all that base knowledge so that you can educate them. Would that be the same for something like, say,
kinesiology tape, K-tape, and probably the same sort of time as Phelps, where you then see someone playing at Wimbledon or a CrossFit Games athlete that's got pink and blue spirally stuff all over their body, holding them together. So if I can start selling that, I've got an instant grab for someone's attention.
Exactly. Yeah, exactly. And at the beginning, when I first started, that was what I had to do, and I've had to kind of do that for my course as well, because people don't look for the underpinning knowledge. They look again. The students look for the sexy stuff as well. So and we do include that in the course, but we include it in phase 4. We've got 4 phases to our diploma, so it's in there. But you have to learn all this stuff first before you can appreciate what this does.
Beautiful. Right, last 5 minutes, and I think it's probably time that I watched you two masturbate.
Always.
Thought it'd never come.
Mike, pick a hand, any hand.
Let's go left.
So, your masturbate topic is the term functional. So, Josh, you're going for, and Mike, you are going to go against the term functional. So, Josh, do you want to go first or second? You probably better go first.
I'll go first.
Cool. So Josh has got 60 seconds, Mike, to say why the word functional is the most important word in the English dictionary. And then you are going to say the complete opposite. 3, 2, 1. Off you go, Joshua.
So functional training, I think, is a really good term because it allows us to differentiate between bodybuilders who are all show and no go, and the other people, the ones that actually want to, be harder to kill and stronger and better at killing. That's kind of why I train, Rambo. And I believe that the term functional or functionality when it comes to training gives us a real good direction as to what we should be doing. So the movement patterns we should be focusing on, activities of daily living, and all that good stuff. And I've run out of stuff to say, so there we go.
Talk about how brilliant functional equipment is.
Functional equipment. Come on. Have you seen a Bosu ball? That's just fucking amazing. Could you get any more functional than doing kettlebell snatches one-legged on a Bosu ball? I don't think so.
And don't forget, every gym has to have a functional zone, because if not, where else would you do all the good stuff?
I'm so functional, I can actually do TRX work while sitting doing a podcast. I may fall over and my chair's rolling backwards. It looks fucking awesome.
Mike, you got 60 seconds. Tell him why he's wrong. What's wrong with the word functional?
Functional training's just terrible in all aspects, really. So the complete waste of money on equipment, TRX, when if you want to do something like that, you can just use a door frame. There's no need for all this functional equipment. You don't need functional gyms. You can just go to the park and functional training. If we're going to look at pure function, like now, what do people do? We sit at desks all day. So to make people sit at desks all day better, we just need to get them to sit at desks for longer, and then they'll be fine. What's the point? All these fancy exercises that are trying to undo things that aren't functional, because function now is sitting, doing an online seminar. There you go. 6 seconds.
Not bad at all. I want to leave this going and see how long Josh is starting to sweat. He's starting to shake. How long is it going to take till his elbow snaps and he dunks that 24-kilo kettlebell into his head?
Well, luckily, I got rid of all my knots beforehand. So, I'm just like a fucking machine over here. My tricep is twitching. Woo!
That elbow is well conditioned.
Keep it up there till the end of the podcast then.
Right.
Mike, it is the final section that is called false, true. So I do believe you have some statements prepared. If you could read them out with your best poker face, and then Josh and I are going to try and decide which is true. Josh, you're making me sweat. Put it down, man, before you have a hernia. Is that even possible? Right, Mike, give us your three statements.
Okay, so this was kind of inspired from what we were talking about before. So I was drunk on a train from London coming back to Birmingham, and my wife was due to pick me up at Birmingham New Street, and I fell asleep on the train, and then I woke up at the next station, which it's about half an hour away from where we live, and she was waiting to pick me up from New Street for ages, and then trying to call me, wondering what had happened. And then I eventually answered the call, and then it was around about 11:30 at night, and she had to drive to come and pick me up. She wasn't very happy. So that was that one. The next one is a little bit shorter. I used to live in Cyprus. And then the last one is I used to play basketball for a national team.
Oh, Josh, you're up first. What are you thinking?
I don't reckon you lived in Cyprus. I think that's a little red herring. Like maybe you worked there for 3 months, but you didn't actually live there. Like you didn't move there. I'm going to go with the basketball one. I think that's a curveball. Mark?
Well, I like the first one is definitely plausible, and basketball one for a national team. When you say the national team, what was the country? What was the nation?
Wales.
Okay, so right. I'm going to shoot down the middle. I think you lived in Cyprus, and I'm going to base that on the RAF connection growing up. I think Cyprus is sort of like a stepping stone out towards the Middle East, and I'm sure I've come across several military people that have been based in Cyprus. So I'm going to go for the middle one, although I definitely think there's some truth in the first one. Your wife was mega peed off, but you've probably changed the names of the stations. And I think you probably had trials for Wales at basketball, but you didn't get in. That's going to be so I'm going to go for that one. What's the correct answer? Okay,
so it is the basketball. Well done, Josh. Yeah, well done, mate. So I did used to play with the Welsh under 16s. It was at the time. Yeah, wow. I thought I'd trick you with that one because I'm only 5'7". So.
Well, I was going to say I think you're probably too short, but I just thought that was too obvious. Well, it was a good one.
I played point guard and shooting guard. So.
Right. I used to be goal shooter.
I lived in Germany, not Cyprus. So you were close with that one. And it was my wife that I picked up.
And she was pissed. Oh, she'd been out with Simon Herbert all day, and she fell asleep and missed her stop.
I started to worry, actually, with his history with adult.
She should have been back hours ago. Shit, she's getting a taxi. What if it's a fake taxi? It's all topical, so it all ties in. Josh, we're probably bang on 2 hours now, but are there any any final little bits and pieces, any real obvious questions that would be?
There's one.
Oh, yes. Let's do it then if we've got time.
So it's 3 days ago from someone in UK PTs. I won't name them because they haven't said yet. They want this out there. So she's put, I'm currently 11 months ACL post-op recovery, and I haven't done any physio, no gym or anything due to COVID restrictions. I've done everything myself. I've managed to get my bad leg back to the same size, but I'm struggling on strengthening it. Have we got any advice? And I think I know what you're going to say anyway, but
yeah, I think if she's not been assessed for 11 months, she needs to get an assessment. Definitely. We've got a really good physio that specialises in ACL at my clinic, Kieran McMahon. I recommend do an online consult with him. He works with British Netball, so he does loads of work on ACL recovery. I'd recommend getting in touch with Kieran.
Yeah, I mean, I thought you were going to say something along those lines, because everyone that we've ever tagged in these posts is they were like, any of the experts say, get a proper assessment first, stop going onto a fucking Facebook group and asking for rehab advice. So no offense to the person that posted this, go and get assessed from a professional and then make your kind of choice.
Yeah. You've also, between you've also just broken the hearts of the 57 people who probably commented, giving their tuppence as to what the problem exactly is and how you can fix it without knowing a fucking thing about the case.
It happens on therapy Facebook pages as well. Yeah, all the time. I've got this patient with this. I think if you need to ask the question, then you need to have an assessment. You need to go see someone, because if you're asking the question because you're not sure. So if you're not sure, then go see someone.
Agreed. So I think that's pretty much us done for today. So I just want to say thank you, Mike, for your time. It's been really valuable. And I'll put all of the notes, like all of your links and, Learn Anatomy Online, everything in the show notes for this. And it will be going live next week. So
brilliant.
Fun times.
Yeah, thanks, Mike. It's been brilliant. Thank you very much for your time. I didn't even notice how quickly the time had gone, and I've still got loads of stuff that I could have asked, but I think that just kind of highlights how big and important an area all of the sort of movement and anatomy, etc., how important they are, and if one thing just comes across to a PT listening to this is to just kind of acknowledge that if they address the chinks in their armor, it may well take them so much further, so much quicker than if they're trying to just kind of get the next sexy thing that they think might be the problem. It's been really, really interesting, and I think 100% we'd need to get you back on when we run out of guests. When people refuse to come on, we'll get you back on again in a few months to maybe talk about the diploma in a bit more detail as well, because it's an important thing. And 100% I'm going to be signing up for the Learning Anatomy Online, because I think at $9.99, Netflix has just gone up to $9.99, and it's incomparable from the amount of time we might spend/waste on one platform. I think that same amount of money could easily be invested elsewhere. So thank you very much for your time and for your work, and we will speak again shortly.
Cool. No worries. Thank you both for having me on. It's been brilliant.
Cool. Cheers, Mike. Bye-bye.
Thanks for joining us for today's show. Don't forget to check back weekly for new episodes. If you want to join the UK's largest Facebook group for personal trainers, just search for UK PTs.